Good morning, everyone. Thank you for joining us for this incredible session. I'm delighted to moderate this session. My name is Sophie Albert, and I'm here with four amazing presenters that will talk about treating ourselves sustainably by putting food justice, food sovereignty, and food equity at the center. I'll let them all introduce themselves, but while you listen to what they do in their work, what their organizations do, I just encourage you all to think about those two questions Robin shared earlier. And at the end of the session, you can all ask questions and we'll have a good conversation. So here we go. We'll start with Kara.
Okay, I'm not used to using a microphone, so I'm not speaking into it. I'm really sorry. So I'm Kara Snyder. I'm the operations manager at Helena Food Share. And I've been working with Helena Food Share since 2015. Took a little break, during the pandemic, and I worked for the city of Helena doing affordable housing initiatives. And then I just came back to Helena Food Share in January as their operations manager. So a little bit different role than I was doing before, managing programs. But just want to talk a little bit about my experience at Helena Food Share and what we do. So if you don't know, Helena Food Share is basically Helena's local food bank. We're the food pantry, and that's essentially all we do. We provide food. We are choice-based, which means that we don't give you a box of food. We actually give you a list, and you get to come into our food pantry and choose options that make sense for you and for your family. We're also need-based, which means if you come to Helena Food Share and you say you need us, we make sure that you walk out the door with food. So every day we see on average 130 families kind of in the greater Helena area. Recently, we've seen days that are as big as 220 families. So we've really just seen this enormous increase, especially through the pandemic, and it really just has not let up since then. So we are in just about every way over capacity. If you were able to come to our tour yesterday, you really do just see this in our operations, how many people are in our space, where we store our food. We really are just kind of bursting at the seams to serve people that come to us. One of the other pieces of our mission is that we provide food with dignity and respect. And so a huge piece of that is customer service for us. And so there's an enormous stigma and shame in coming to Helena Food Share and saying that you need something so basic as food. And so we really do try to replicate the kind of service that you get at any other grocery store, and if anything, elevate that service. And so we pride ourselves on providing the best customer service and the best experience in town. So we really want people, if they can make it to Helena Food Share, to know that it's a safe, comfortable space and to feel comfortable coming back. So you can come to Helena Food Share up to 4 times a month. But on average, we're seeing people come about 4 times a year. So that's kind of one of the big questions that we have in just about every tour or everything like this that we do is kind of this assumption that there's a maxing out of services, and we're always wanting to dispel that myth and let people know that people come to us when they have to, and then they share when they can as well. So I'll just go over, we have quite a few programs, but I'll just talk about a couple of the relevant ones really quick, and then kind of some of our local food initiatives that we have going on. So our big one, the one I already talked about, is grocery share. So that's what everyone thinks of when they think of Helena Food Share as our grocery store. And then we have our Kid Pack program. And so we're actually serving 24 sites right now. We're serving every single elementary school and middle school in Helena. Same in East Helena, we're serving Boulder, and we're actually serving Lincoln as well. So just an enormous program. It's grown every single year, and this year we're up to 1,300 of those kid packs every single week. And that just provides a little weekend nutrition for kids who might be relying on the school system for a lot of their daily needs. We have a holiday distribution in November and then one in December as well. And between those two programs, we serve 2,500 households in Helena. So that's kind of our other big push. So in 2016, we launched our nutrition initiative, and that was a set of programs, goals, and partnerships that were really aimed at elevating the level of nutrition that you can find at our pantry. And so we really wanted to have more fresh food. We wanted to have more local food. And we wanted, when you think of a food bank, you think of a lot of probably like dusty cans and a church basement. And we really wanted to change that. And we really have. So in 2016, we launched our nutrition initiative. And one of the first things that we did is we had an AmeriCorps Vista project that revitalized a garden space on our property. And we saw that as a kind of a community space where people could learn, see where food comes from, grow their own food. We never locked the fence. So we have people that come in, they might harvest some tomatoes or some onions. We've had people come in and plant as well. So sometimes our gardener comes in the morning, he's like, I have no idea where these onions came from. This is so wonderful. So it's really, we see it as a community space. It's not our garden, it's, the community's garden. And now, since that Vista project, we actually have a full-time person that manages that space. We also installed a high tunnel just a few years after that. So we got a grant through NRCS, and we really just wanted to extend the season. What more could we do? Could we really actually grow some portion of our own food? That's also been very successful. We lost the covering during a storm last year and just replaced it, and it's been going really well. We started to purchase lentils in 2016 from Timeless Seeds. And since then, we've done a lot of education and samples, and we've had chefs come in and demonstrate how to use lentils. And since then, we've now had a variety of lentils in the pantry. Just about any time you come in, that's a product that you could get. We've also tried chickpeas, barley, farro. Some are more successful than others or more popular, but it's always just been a really fun experience to have those in the pantry. We also started a Harvest of the Month pilot, which you probably all know about now. In 2016, it wasn't as known about, but we talk about each new product. We have it in the pantry, and we'll do demos and recipes, really just feature that for that month. We also worked with the Helena Community Gardens to increase donations, just knowing that that's some of the most local product we could possibly get. It's literally just from the gardens around Helena. We also constructed a farm stand on our space. So through all of this, we learned that we really don't have the capacity to serve the kind of foods that we want to. And so we had to figure out a way to respectfully do that. And part of that was creating this really cool kind of farm stand out in front of our building. And we'll put stuff out there. It's take what you want. And it's just a really fun space where people get to go and peruse some fresh vegetables and talk about what they're going to do with it and meal plan a little bit, and then come into the pantry and further supplement that shop. We also got a grant from the city of Helena, and you're probably going to hear a little bit more about this later too, but we used it to purchase what we call the Charlie Cart, so the mobile food demonstration kitchen. It's a super cool little demo cart, and we were the first food pantry in the whole country to have one. And it comes with a curriculum that's kind of aimed at elementary age children, but we use that kitchen to demonstrate all of our recipes. We hand out samples from it during our open hours. And then now it's actually in 10 elementary schools this year, providing that curriculum to elementary age children. We also started to purchase local kamut and jerky, and we're putting that in our kids pack program. So certainly a push for us budget wise to do something like that, but really want to use what purchasing power we have to put into the local economy and try to give kids as good of a nutritional experience as we can with these packs. We're currently working with Hope Mountain and Oregon State University to develop a kind of locally sourced granola bar. So hopefully down the road that'll also be in our packs. Done cooking classes. We started doing fresh food drives. Through the winter, it's kind of still the produce section is a bit barren, and so we're trying in every way that we can to get a little bit more fresh produce in there. That's been super successful. So on any given day, 8-9 years ago, you might not have seen anything in the pantry in that produce section at 3:30 when we're about to close. But now we usually have a couple options for people. So I'll kind of just wrap up by saying this is no longer an initiative. This really is Helena Food Share's commitment to always try to provide something fresh and something local inside of our pantry. I don't think there's a single day that we're open that you can't find something fresh or local there. We purchase from about 20 farmers right now, just kind of in this Helena area. And then along with that, we've also really tried to kind of rethink that paradigm of charity. So we're not here with our excess handing down to somebody in need, but we're here sharing what we have and really thinking about the words we use and training our volunteers as well. We really had to fight probably in the last 10 years ago that it's not the fault of our customers that there are resource gaps in their lives. There really is an inequitable food system at play that doesn't allow for some, especially people on fixed incomes or limited incomes, to purchase the things that they need. And it really did just hit me kind of during that opening session that having choice on your plate really is a privilege. And we know that we serve people who don't have a lot of choice in their lives, and we want to provide as much of that as possible. So, thank you.
Okay, can you guys hear me? Everyone? Cool. So, my name is Sharon Small. I'm the Executive Director for the People's Partners for Community Development. Oh gosh, I've been with PPCD for about 12 years, and they hired me and they're like, Sharon, you're gonna start a CDFI. And I was like, okay, I have no idea what a CDFI is, but I'll give it all I got. So a CDFI is a certified financial institution for those of you that are not familiar with the CDFI. And so we got the CDFI up and going. We help people repair credit, build credit, start small businesses, and just a variety of different things. And then in 2018, we did a leakage study report on the Northern Cheyenne Reservation, and 72 cents of our dollar left the reservation. So we're like, how do we keep that local to create jobs and to create an economy? And then next thing you know, COVID hit. I knew nothing about, well, I knew a lot about food because I'm a third generational rancher as far as just our land-based, how important our land is and the importance of food locally within our family. But I never really honestly took a look outside of what I was doing to really take a look at food until COVID hit. And then when COVID hit, like, I think I can do anything. When COVID hit, we couldn't get food. Like, it was such an eye-opener for us. And I was like, oh my God, we have people, elderly, that are not eating. We have youth that are on the street that are not eating. And we have families. Our average family household is 13 people per house. So you're thinking of these households, and it was just a huge, huge eye opener. So I went from being the CDFI guru to like, okay, how are we going to get people food? So there was, during COVID, there was like, you know, it was horrible in our area, but there was also a lot of opportunity, if that makes sense. So we have about 8,500 head of cows that leave beef, that leave the reservation every year. And so I thought if we could just keep a third of that here, we could feed our people here and locally sustain what we have without leaving our boundaries, because we couldn't leave our boundaries. That was our limit. So I put in for a grant, and we received a grant through the state of Montana and through the Northern Cheyenne Tribe and a couple other funders, and received a mobile beef processing unit. So at the time, it was anywhere from 12 to 18 months for a producer to be able to get their beef processed. So the demand was huge at the time. So anyways, we started the beef processing unit. We couldn't, it was really a challenge, but it was so rewarding at the end of all of it. And actually it's not even the end, it's we're in year 2, but so cool. Like, it's so cool to be able to actually see what we're consuming on a daily basis. And so I'm like, okay, we also need some produce. Like, people didn't have a place to actually go get like fresh produce. So we had this building at the time where we put the mobile beef processing, where we would go and process the beef. And there was this empty space and there was an existing grocery store, and I'm like, cool, let's do add-on, let's just do the grocery store too. And thinking that it was like a super easy deal. And oh my God, I was like, who would want to own a grocery store? But after we started the process, and it was like no looking back, we already were like full force, and I'm like, I'm not giving up. We're gonna do this. And so we finished, we got the grocery store going with the mobile beef processing unit, and we're able to get fresh fruits and vegetables, which is a big deal. Like, I didn't think it was that big of a deal back in the, in the day, but now it's like, wow, we feed on an average of 62 families a day. And keep in mind, like I said, there's 13 people per household. So it's like, you really are serving a huge, huge capacity. And so then I applied for the LFK Plus. Or is anybody familiar in here with the LFK Plus? Like, was so cool because so many of our producers wanted us to purchase their beef, and we're like, we don't have any money to purchase local produce, beef, whatever it is that, they wanted to. So we just recently got that and super excited. We're gonna do buffalo and beef. And we also take our mobile beef processing unit up to the Fort Belknap Reservation and process buffalo up there, which was a super, super cool experience. And I don't know, have any of you had buffalo? Buffalo? Yeah, it's a game changer. So I think that's going to be kind of like the next big hit. We're doing beef sticks, jerky beef sticks. And then I don't know if you guys are familiar with that. So we're doing all kinds of like other traditional components. We want to add the education part of it for the youth. And of course, our elderly to teach them, all the old ways of the food system, which is really cool. And there's a lot of interest, and they're super, super excited about it because a lot of them don't have anything to do. Those elderly are really, really left out. And so we're excited about that component. And then along with all the food system, you have, like I said, the financial. So we're in a financial desert. We're in a food desert. Our, Billings is almost 100 miles for a lot of us. And Sheridan's 85 miles or 90 miles. So it's tough. A lot of our people don't even have transportation. So we also opened up a credit union in the mix of all of this. We opened up the Morningstar Federal Credit Union. It's the first one that was chartered in the state of Montana in the last 10 years. That was probably one of the biggest challenges too that I've gone through, but it's so interesting to people that come in to get $500 loans to buy, an oven or to buy a smoker or whatever it is that they're going to use for their the food system. It's just really, like I said, an eye opener to see what is happening in our world. But I think at the end of the day, my ultimate goal is like, how do we become self-sufficient, and how do we sustain what we have everything locally. Like, we have everything we need, we just have to implement it. And I think it's a challenge the way our children are being taught, and what kind of food you're putting on their plates, and what kind of food that you're encouraging them to eat. So the educational component, I think, is going to be really, really important for the next generation to come, and starting now. On as far as health, you look at, we have diabetes in our area, we have, it's just it's unreal, like, to look at how the food system really, really plays such an important role in our everyday lives and how we live and how we think. So yeah, I'm just super excited. And yours is super cool, the mobile food truck. Like, we have districts on the reservation, so I was just thinking if we could have a local food truck to go out to each of those districts to be able to get that food out. All of the food that we do process goes to the food pantry. So on the reservations, So it's really, like I said, would be cool because right now, I think everything goes for later. We try to, when we have the capacity to do it, get it to out to district, but to be consistent and really get it out there, I think would be cool. So kudos to you, that's awesome. But I'll be here for a little while after if anybody has any questions, and thank you guys for.
Hi, I'm Gretchen Boyer. I'm the Executive Director of Land and Hand. And our roots are deep in Arrow. Our founders, Pam Gervey and Barb Brandt, were on the board of Arrow, and really our organization came from Arrow. And we started as, we were called Farm Hands. And we started with the idea that we wanted to connect our community, which is the Flathead Valley, to local food. So we started with a farm map, and it was a really beautiful map on paper that listed all of our farms and ranches, and we had these beautiful icons on, you know, the things that they offered if you could go visit. They accepted SNAP. And then in 2012, we created a digital farm map. And then we really started deciding that our community, while we had, you know, Flathead Valley has an amazing agricultural history, and a ton of market farmers, but the connection to the entire community was lacking. So we were an all volunteer board from 2002 to 2017, and we partnered with CFAC to start on a community food program grant to start what is now Double SNAP dollars. And we had done that ourselves as a whitefish farmers market, and then kind of leveraged the knowledge at CFAC and what we had to create a statewide program, and CFAC is really driving that. So that's kind of our roots as an organization. And we kind of are in two realms. We do food access and we do education. So our food access programs, you know, I talked about Double SNAP dollars. We are a spoke of the CFAC hub of Double SNAP dollars, and we support markets in Flathead and Lincoln County, and run the program ourselves at Whitefish, Kalispell, and Columbia Falls. And along with Double SNAP, we run a various other food access programs. And those programs include a program we call School Coins, where we go into, it's kind of partnered with education, but we go into 5th grade classrooms all throughout Flathead County and teach about the food system, teach about how far food travels. We have kids pick a meal that they have at school and think about what could they buy locally, and how, if they don't buy it locally, how far does it travel? They're usually about 15,000 miles each meal. And it's just a tangible way for kids to think about what grows in Montana, how do they access it? And they can come to the farmer's market and get a $5 coin to spend on fruits and vegetables of their choice. We do a senior coupon program, which we've done on our own for many years. We just have raised money and make our own coupon booklets, but this next year, we're going to partner with CFAC and be a host site for the senior farmers market nutrition program. Is that how I say it? I'm looking at Ian, he's right here. Which is exciting because we have, I think, having that all over the Flathead Valley will be really exciting. And then our kind of flagship program that we're really building and excited about is our Food RX program. So it's a produce prescription program. And we work currently with 8 Logan Health clinics. And they the practitioners identify patients with chronic illness who are food insecure, and they offer our food prescription program. And when folks enter it, they have an opportunity to receive a bi-weekly produce share. And in the summertime, they have the opportunity to come to the farmers markets in Kalispell, Whitefish, or Columbia Falls, where we host food access booths. So currently we have, is Mara in the room right now? Oh, my Mara. But you're an awesome Mara too. She runs the program. I wasn't sure if she was in here, but I think we're at 54 families, and probably 180 total folks. So when we enroll a patient, we enroll their whole family. So if it's a family of 4, or if it's a family of, our largest family is 9, because we also do it in Eureka as well. We give a produce share based on the size of their family. And then every week Mara creates these amazing guides to the produce. So it'll have pictures and the common ways that they're used and how to store it. And then there's always a recipe. And this program we're really excited about, and probably could expand it 1,000 times over, because we have clinics calling us every single week asking us if they can participate. We also partially fund that with a grant that CFAC did with the USDA, which has been amazing. And then the other really important program we do is we do the weekend backpack program for the Columbia Falls School District, Deer Park and West Glacier. And this really came out of a need when we first came into the Columbia Falls School District, that they did not have a backpack program and the food bank did not have the capacity to do it themselves. So we jumped in because it's shelf-stable food, which our mission is really to build a strong community food system that fosters socially just ways of accessing food. So we really want to be connecting with local food. And so we started the backpack program because the current program they had was through Feeding America, and the food was really low quality. And so we couldn't stand by and watch that. So we improved the quality of the food. And when we first started, it was about 180 kids. And we're at almost 400 a week now, which is hugely significant. Columbia Falls and the Flathead Valley in general has changed a lot since COVID. The income disparity has increased tremendously. And so there's a lot more folks that have to pay rent, and food is not as, they have way less money to spend on food. So we're serving the community, and when we do our best, when we think about all these programs that we do, we're really thinking about, as Kara said earlier, like, how can we do our best to make sure that we reduce as many barriers, we reduce stigma as much as we can, and we serve compassionately our community. So, that's really our goal with the weekend backpack program. They're in the schools, but then we also have a contactless pickup that we started during COVID. And we have, especially at the junior high, there's a lot of stigma at the junior high about needing food. And now our building that we have in Columbia Falls is located at the junior high. So we put out bags on the table, and we have about between 40 and 70 bags a week that go out. Because between the 2 elementary schools, it's almost 300 kids. And then you get to the junior high and it's 25, which is not accurate. So every time we're getting a lot from the junior high, we feel really excited about that. And then our most newest program is our farm to school program. So as you probably all know, Food Corps left the state of Montana, even though it started in Montana. And which really brought awesome young people in school districts to teach about garden and nutrition education. And we think about moving the needle, as Robin said, our youth is where we need to be starting. They need to be educated about the food system and the value of growing food and picking food from the garden and putting it in their mouths. And we know that when kids do that, they're going to try a lot more different kinds of foods. So we took over the program for Columbia Falls. It's been this amazing partnership with the school district. They have a really awesome half-acre teaching garden that is now ours. We put a building right in front of it that we moved. It was crazy, but we did it. And it's cracked in some places, but it's okay. And we now have this great teaching space to work with the youth in Columbia Falls. So we have, when the garden's open, every classroom in the entire district has the opportunity to come do classes 3 days a week. And then during the winter, we focus on 2nd grade. We have a whole curriculum that we use that includes Harvest of the Month work and Food Corps curriculum. And we're really hoping that we're influencing the next generation of eaters and maybe farmers. Our goal is to have a farm internship program with high schoolers. You just see endless possibilities of that program. So that's us. Thanks for having us.
Good morning. I'm Lisa Lee. I am the co-executive director for the Montana Partnership to End Childhood Hunger. I have a very simple slideshow, but I'd also like to introduce Kay-Ann Miller, who is the co-ED alongside of me. All right, and the Montana Partnership to End Childhood Hunger is a very long name, so you'll hear me reference it as Mount Peck from here on out. Once we get the slideshow going, if you keep going to maybe the third slide. There you go. Perfect. So here is our mission, our vision, and our focus on nutrition security really means that we're creating systems to give all Montanans, especially children, access to nutrient-rich, culturally appropriate, and locally grown foods across Montana to address their health and nutrition needs. So that's what it means to us. We accomplish this by partnering with very targeted audiences, and for us that means schools, summer meal programs, and in healthcare. A good example of a healthcare initiative where we're integrating nutrition inside of healthcare is what Gretchen just explained, but we're seeing a lot of produce prescription programs across the state, in addition to so many others where it's medically tailored meals, just very different approaches because healthcare has a lot of capacity and they're in a lot of rural places. So it's necessary for them to expand, but also join forces with the education. Mount Peck was founded on March 7th as a nonprofit organization. So we're very new, that's 2023. So we're very new as a nonprofit, but our work goes way back. So we started in 2011 as a statewide coalition. Our work really has been around what's been a 10-step to an 8-step to now a 9-step plan to end childhood hunger as a coordinated approach and getting all the partners at the same table to really collaborate together and plan our strategies of what's working well, where are the gaps, and then be at that same table. In recent years, it just made sense to continue to expand the work. We've been talking with so many partners over the phone, in person, online, where it just, you know, when thinking about our No Kid Hungry work, which is where we came from as staff, it no longer applied to them in the same way. We knew we had to expand. So our team with Montana No Kid Hungry, which some of you might know us as, shifted under Mount Peck, and we will officially launch at the end of December of this year, which is really exciting. And Montana No Kid Hungry has actually gone over to the Montana Food Bank Network. Ren is in the room here, and they will continue on with the school breakfast and the summer meal program work. So we're not losing any resources. We continue to gain and work together over time. All right, now we can go to the next slide. So, this is perfect. All right, we do a lot of things, but grant making is the #1 thing we work on. We've chosen grant making because when you ask what resources are needed in the field, funding comes up nonstop. So it just made sense for us to carry on that view of the work. And we've always been able to be a very nimble organization as a funder. So it seems to really work for folks. When we talk about grant making, we do extensive outreach. If we, you know, in the past when we put out broadcast emails that, hey, we're announcing the next grant round, you get a lot of the known suspects, but until you really get in the field and meet with a lot of people locally and go to Eastern Montana and go to reservations, that's when you see the people that are, you know, the heart of the work and getting things done, like a Sharon. It's pretty amazing. And we really are guided by data too when we look at the state. And so we kind of take the data, we make our plan for the year, and then we start making trips to visit folks and really understand what the challenges are on the ground. Now, equity, of course, it plays into all of our work. It's woven through, you'll see it throughout as I'm talking today, but we serve a very large geographical state. Montana just really spread out. Eastern Montana, a lot of folks there don't even feel like they're a part of the rest of Montana. So it looks different when we're looking at solutions, and we need to meet them where they're at. So we really kind of look at building infrastructure in those areas and making a much deeper investment when we're going to serve them, and a long-term commitment too. And it's important, I want to just note here that, you know, when you're working in local communities as a funder, this isn't our work. So it's like we're looking to the local people to help guide us on what they want to see. And so, yeah, it's not a cookie cutter approach. And by that, we're able to just meet them where they're at. Now, I mentioned innovation here because it's important to know that we encourage innovation, but we don't see that because so many folks on the ground are struggling, in terms of just always being in survival mode. So it really takes those hardcore conversations where you're like, okay, here's some best practices of communities that are doing similar work to you. And it helps to open up minds, because everyone's passionate about their job. They're there for a reason, right? But until you have those harder conversations, it's like, oh yeah, I really want to do that. And yeah, now I can see the vision of, and can I talk to that person? Then we help connect, we don't want to be the middleman. We just want to connect the programs directly and like help them out and get to the main goal. But otherwise, no, it feels like really the more training, the more insight, the more knowledge you can lend to all these local programs, they can get further themselves. Collaboration, coordination, we work together collaboratively with a lot of different partners. There is so much work out there, and we keep saying this, Kayan and I, really, we're not stepping on toes here. It's just like, how do we work together to get further together? So I really like the lens that Arrow is presenting here today of really how do we move that needle collaboratively and get all the right people to the same table to talk about that. Relationships, building relationships and trust are the cornerstone to our work. When I first started with launching Montana No Kid Hungry, I went to every single reservation in Montana and I met with local people, organizations, even tribal councils to really understand the needs and see the beauty of each of those communities. In that process, I still carry away all of the relationships I built over a decade ago. People have moved positions, we're still in touch. Like, it's such a beautiful thing because Montana is such a small state that you can keep carrying on those relationships. So I really encourage everyone to think differently about the time investment when we're talking about relationships. And as a funder, we're learning just as much from every grantee as along the way, and we're continuously reevaluating our strategies, our work, how we can be a better partner in the process. So it's really like helping us be more innovative and dynamic along the way by just what we're learning from each of our partners. And then at the same time, we try to leverage all of the statewide organizations that can help, get things a lot further from a systems level. So it's like we hear the on the ground needs and then what needs to happen up here to help make that happen on the ground. And so we're constantly in those more systems level conversations. Action, we can all keep talking about the challenges. We know how many challenges there are across the state, but until you kind of make that time to act and do something, that's when change will really happen. And for us as a funder, it's just like those changes need to happen locally, and those drivers locally are the people organizing the work. And really, if without them, they're not able to sustain it. So we just see our hands like a funder of like, we can, yes, provide support if you need it, but if funding is all you need, we can be there for you too. Next slide, please. Now, our role in the food system, we look at hunger through the lens of nutrition security and food systems, as I mentioned. And so when looking at the food system itself, we try to improve food access when it comes to nutrient-rich, locally produced and culturally appropriate foods. We're really trying to build up the systems to nourish people perpetually because we are in a food and health crisis across the entire state, across the nation. Now, when thinking about building the demand for local food, we approach it from an institution level. So when I'm talking about our main partners being schools and summer meal programs and healthcare, we hope that more connections can be made that are seamless so those institutions can get local food in this context. And then, of course, strengthening community and Montana's food systems. And that's where we work at a food systems level, but that's where our grants are most important. Now, next slide. I'm just going to run through a few of our examples of grants. Oh, but I just noted in my notes here that I just wanted to also share a little bit of our work outside of grants. So when I talk about food systems, you're like, what does that actually mean? And one example of that is advocating for Medicaid to be added to direct certification. And that means that any family that qualifies for a certain type of Medicaid would automatically qualify for free school and reduced school meals. Sorry, that didn't come out very eloquently. So if you qualify for Medicaid on the back end, you can just automatically enroll in school meals instead of having to fill out yet more paperwork. So OPI, DPHHS were able to come together, apply, and then build the system on the back end to be able to do this. And it was launched in July. As a result, almost 34,000 students now automatically qualify for free and reduced price meals. Yeah. And that really goes to OPI and DPHHS. They put a lot of time in to make that system perfect. But now the trickle down effect from that, talking about food systems change. So of course, this means that it's going to help more families that are food insecure, right? But it helps to address stigma because more kids are able to participate in school meals and then they don't question themselves, especially once they get to middle school and high school. It also supports the school nutrition budgets because higher budgets allow them to order more nutrient-rich foods or, where they can cook from scratch. They can buy local foods, indigenous foods, and so forth. But it also leads to a greater percentage of free and reduced price meals in schools. And then schools can then actually opt in for serving free meals to all students. And that's called Community Eligibility Provision, CEP. But this huge increase is going to lead to more schools being able to serve free meals to all students and meet their budget at the same time. So that's very exciting. Another example of our food systems work on the ground is really around the summer meal program, because last summer, for the first time, the USDA allowed non-congregate summer feeding. And so I know that. For those on the ground that have done summer meals, it's always been congregate style. So you have to sit down and eat a meal and sit there until you're done. If parents join, they're not allowed to eat or with them unless they pay for those meals. And so it's just kind of like very cookie cutter up to this point, aside from COVID. Last summer, this opened up from the USDA. Our Montana OPI office was very amazing when it came to this. And everything trickles down really fast from the federal operations down to the state. And they had to roll this out really quickly. And they allowed sites to just basically share how they wanted to do this. And it was only for rural areas. As a result, 103 sites in Montana basically started non-congregate feeding across the state. And all of them saw their numbers double, triple, and even quadruple just because of this rule change. So sites were able to provide multiple meals worth, multiple days worth. It helped with weekend meals. So it just changed the game when you're looking at summer meals. And that was just a pilot this last summer. We saw so much success. Now it's rolling out to be implemented fully this next summer. And in the same time, summer EBT is finally coming to Montana. I see some nods. That's it's another rule change at a national level that's going to do a lot of good for Montana because we still have 13 counties that don't have a summer meal site. So, it allows us to think differently, and all these programs really complement each other real nicely when thinking about how to do better in rural areas and serve people. Now, just a few of our grants very quickly. I don't know if anyone here is from Mission West. No? Okay. We were able to grant to Mission West Food Enterprise Center in Ronan, really in the spring. They were excited to develop a new breakfast bar, basically for schools using local food ingredients. They've done Montana marinara sauce. It was very successful for schools. They know how to kind of work the system. And then they even tapped into OPI's distribution system to help get that product to schools. Now, the next phase. So they have a breakfast bar, which should be finalized in early November. It features Montana lentils, butternut squash, and cherries. And then after the bar is finalized, Mission West will do a sample run with schools to do taste tests with the product. and like with the school food service directors, but also the students. And then from there, create a contest so the students themselves can name the bar, which is very exciting. So again, like just one product, but imagine, what this can do across schools in Montana. And breakfast is such an important meal, but schools are really challenged with actually doing breakfast right. And unfortunately, a lot of the products there tend to be high sugar, ready-made things. So just having something locally made, but also very delicious at the same time is going to go a long way. Also in the spring, Mount Peck awarded a grant to St. Peter's Health for approximately just over $9,000 to support the Harvest of the Month program in Helena. Kira talked about that a little bit, but I just want to note how successful that program is. It's in every elementary school across Montana. That's 11 schools now over just the course of 3 years. They integrate older teens to come and help teach the lesson plans around Harvest of the Month. And so the teens actually make the recipe in the family and consumer science class. They come in, they teach the lessons, they do taste tests with the students. And trust me, because I had a fourth grader 2 years ago that went through the program, and now another one. Like the older teens are just like celebrities, and they're just, it's just very cute to hear like what comes out of that. And then, really from this program, we're thinking of it as a nutrition education program, because when talking about food access, we also need the other hand, right? Nutrition education plays a big role in exposing kids to new foods. And this program here in Helena allows every fourth grader to have baseline nutrition education by the time they're done, which is really cool. Another program I just want to mention here is through the Flathead Reservation. We worked with the tribal and MSU extension offices. They identified that older teens in many households are the ones cooking the meals. And as Sharon alluded to it, a lot of I think you said 13 people are on average are in households. That's what they saw, the same thing there. And so they looked at the problem and said, how do we help older teens be equipped with their knowledge and skills to be able to do this? So they started this pilot program as like food cooking skills. And at the end of it, they kind of worked all the recipes around an Instant Pot. And every participant at the end of the course got their own Instant Pot for their families. Yeah. And the word spread so fast that every school on the reservation now wants this program. So we just gave them yet another grant to be able to do that. But it's just so cool that, it's just such a small idea, and then it's now exploded and everybody wants it. And the Instant Pot of all things, right? But it makes sense because we have one, and it's just that you can cook meats from frozen. You can do things really quickly. You don't have to have a plan, and then have a good healthy meal at the end of it. And lastly, Browning Public Schools is a great one because Lynn Keenan was the food service director for years. She just retired, but before she left, and she's the one that executed breakfast at the bell at almost every elementary school. Then they asked for a grant, and she had 2 summer food trucks to like reach every corner of the reservation during the summer months, and then came back and said, we want like traditional berries at the school. How do we do this? And it was like, what do you mean, how do you do this? Like, let's just do it, So Keanne was actually involved in this and helping with MSU students. But yeah, now in the spring, we hope to plant 80 to 100 traditional berry plants at the school where youth will be involved in the planting, but at the same time, they can harvest those berries over time and then incorporate them into school meals too, which is great. So this is just like a few of the projects, but you can see like how one little seed that you plant goes on to do just such amazing things. And then, there's CSKT is talking about one project, and over in Northern Cheyenne, they meet up, and then, just so many great things happen in connecting people and organizations. And so we can see this unlocking the power of local communities and having local people lead the efforts, but also sustain long-term. And lastly, I'll just mention, because this was Robin's question that we had to answer through the presentation, was just like, what resources to help grow the movement? It really comes down to funding and staffing capacity. That's what we hear. That's why we landed where we landed. But We just try to make the process easy and provide support. So more local people can come up with these amazing ideas and see more of it. I'll stop there. Thank you.
Thank you all. It's so exciting seeing all these like different initiatives across our state. I work in food access too, so I love hearing from Kara. And I think we're all coming together, finding there's so many food pantries across our state, but we're developing this like food pantry collaborative. Everybody's starting to work together, applying for grants together. Then I loved what you shared about just like economic development and food access really coming together, and Gretchen working with the healthcare system and working with funders. All such important topics. I'm going to hand it over to all of you first for questions, and then we're going to discuss some of those key items we wanted to talk about today. So any questions in the room? Do you want the mic?
I can talk loud. Is
Okay.
it loud enough?
Perfect.
I have questions for all of you, like a list of questions. I won't ask them all. I guess just kind of a common theme. I'm actually from Haver, but I'm coming right now from the University of Texas in Austin, and I work in nutrition education through school garden programs there for the nutrition department at the university. And I'm wondering for all of the programs that have this nutrition education component, do y'all have RDs on staff or on call that you can get some of those resources from? And then once you have access to that curriculum, who does the actual teaching? Like, what does implementation look like? So where is that knowledge coming from, and what's the role of RDs? And then who's doing the education for any of y'all?
I can start with that. So we host dietetic interns, so that's kind of our connection point. And right now we do it twice a year. We just had Millie just finished with us. So the way we utilize them is we have them review curriculum that we have. We work with a lot of food core curriculum and Harvest of the Month curriculum. We do not have an RD on staff. But we feel like we have some touchstone points. But with our food prescription program, we would love that. We talked about, really, produce prescription could just be endless. There's so many things you can do. And Fast Blackfeet actually has a dietitian on staff that meets with all the patients that they have in the produce prescription program. And the last dietetic intern we had, she's staying in the Flathead, and we're like, well, maybe we can figure this out. But we see that as being very valuable. Because when we're working with like produce prescription clients, we have to be really careful about what we say, because we are not medical professionals, and we are working with all these health metrics, and we have so many clinics that we're working with and trying to figure out how to make sure that we're attending to patients' needs. We work on the barriers. That's what we're really good at. So your car breaks down and you can't come get your food. How are we going to help you? Like we're pros there. But when we have a patient who's suddenly diagnosed with cancer and wants to know which food she should prioritize, we're really going to the practitioners and saying, we need your help in this realm. Because again, we don't want to advise because we don't have the knowledge. So we try to leverage our community as much as we can. We'd love to do that better than we are, but we're, right now as our capacity with funding, we can't afford to have a dietitian on staff right now. But to me, that would be the ultimate goal. And I think FAST is a really good example of that. They're doing a great job. And their dietitian, when she sees patients, she can build through a clinic that they're in partnership with. So like that idea, I really love, and we just have to figure that out. Anyone else?
I feel like I could probably echo a lot of what Gretchen just said, but we are always the first to admit that we don't have all of the skills, and we may not be the best people to be teaching something. And so that's where, certainly very community-based, and we really rely on partnerships and look to the people that do have that knowledge. So when we first started doing nutrition education, we really leaned on Montana Extension, and we had our SNAP educator at the time coming in and providing nutrition education and cooking classes. And then our AmeriCorps Vista member at the time also kind of created kind of a more specific curriculum to the garden at the time and to elementary age kids that he was working with. And so I guess We also would love to have a dietetic intern. I think we've happened in the past. We love to have someone on staff, certainly where we're hoping to go in the future in our new building, which you probably have mentioned in my intro. We just broke ground on a new building where we'll have a kitchen, a teaching kitchen, and a production kitchen. But yeah, certainly always Helena Food Share has relied on our partners and always just work together to do things like that.
So I am on RD, and so this definitely hits home for me. Through the food prescription program work group, that is statewide, nutrition education came up, and there's actually now a committee of us dietitians working on that and pulling kind of all the resources together. So people are at least looking and streamlining the information. It does come back down to staffing capacity and like just funding and not being able to have a dietitian. We'd love to see that in schools. You know, every school is locally controlled here. So we can't share a dietitian. That would be lovely if we could get past that point of thinking more broadly. The other thing statewide too, is that we have been working with Medicaid to talk about expanding MNT services. So more dietitians can get paid for more of their work across the state. So just, you know, and it can be through telework too. So this can just naturally happen. But I would agree that Fast Blackfeet is a perfect model. Mackenzie, the dietitian, is at their food bank, and they actually have health practitioners that refer patients that screen positive for food insecurity to the dietitian, and then the dietitian does group individual counseling. She takes them to the grocery store and does tours of the grocery store. So it's just kind of like a beautiful model that we'd like to see everywhere if we could just get the funding and resources that complement that.
Thank you all. What other questions do you all have?
No, that's okay. This could be a question for each of you, and sorry if this ends up being redundant, but I'm curious what you perceive as the biggest barriers and the biggest opportunities in terms of like serving the communities you serve and what you want to. Oh, yeah, sure. No.
What are the biggest barriers and the biggest opportunities in the communities you serve?
Yeah, so ours is capacity. Like we started with 3, we're up to 27 now, but we're doing like 150 jobs.
Yeah.
So I think capacity is huge. And then the education piece is not even a part of what we're doing right now. So I'm sitting here thinking, gosh, I wish we had like a food network coalition, or you know, some sort of like, how do we connect all of this? Yeah. There's so much good information that could be carried across the state. Education. Capacity.
I mean, capacity is definitely a barrier we have too, because the opportunity is so huge. I mean, farm to school, I think in the state, there's 5 nonprofits that run farm to school programs in the state. Park County, Gallatin, us, and Missoula. And then one, no, I think it's just 4. There's 4. And the opportunity to teach nutrition education in schools. And it's happening in different ways in lots of different school districts. But it's, you know, I think as Lisa said, it's not universal. So I would love to build capacity because, as I said, like even with FoodRx, you know, there's endless clinics that want to participate. So the opportunity is, you know, so there. We could have a Flathead County Farm School in a heartbeat. I need 10 more staff, and a lot of money to pay them because the standard of living in Flathead County has increased tremendously since COVID. So those are the things that we think about all the time. Farm to school is what I would love to expand in FoodRx.
Well, certainly we can always use more money. We can buy better food, we can buy more food, we can serve more people. The more we have, I think the more that we can do for sure financially. But really, I think I kind of touched on this a little bit, but one of the biggest things that we do is we really do just dispel myths, and everyone thinks that they know what we do. They think that they can tell you what happens at Helena Food Share, what happens in our pantry, but every single person that comes to visit us usually is pretty shocked by something, either the amount of people that they see in the pantry. If you're from Helena, you might see people you know, you might see people you went to school with, or friends of your children. I think to me, like one of the biggest barriers is really the invisibility of food insecurity, and how rarely we really talk about it in very real terms. And so for us, it's really important to really just see the people in front of us and not just the need. And really, for us, that's just been all about community building. And so in some ways it seems very simple, but something certainly worth talking about.
Transportation, also major barrier, just getting to places. All support services are really spread out. It just makes it really hard on family members that are trying to work, actually get to places. Transportation, if it exists, is very limited. If they have services available, hours of operation are very limited. They have limited staff. It's just like this ongoing battle. So definitely that. I'd also like to say, like we're just seeing so much interest. And I think as you see the momentum build in different areas like Food RX, for example, a work group started that's statewide, and now all these programs are working together. Indigenous foods in schools came up as like an interest area for so many schools across the state. There's over 800 schools. And as that came up, now we're hosting Indigenous Foods in Schools collaboratives, and bringing people together that are schools, statewide folks, even nationwide organizations that want to help support them. So it's just, the more we can kind of carry on and be collaborative, I think you just get further. The other point, based on Kara's answer, I just want to note is the more you can involve people that have lived experience of hunger and poverty, it helps to make your solution stronger. With Mount Peck, we have a food advisory board made up of people that have lived experience. And honestly, they help guide our solutions. They're engaged in our work, and they help make sure that every strategy we choose is going to have the most impact for the people we're trying to serve, instead of us being up here thinking like, oh, this will work. It's like actually talking to the people that are using the food and the system that you're trying to create. So thank you.
Thank you. We had a question in the front here.
Well, actually, I'll make it into a question. I'm just wondering if you are aware of an organization in South Dakota called Red Cloud Renewables. And somebody, anyway, it was started by Chief Henry Red Cloud, fourth generation descendant of Chief Red Cloud. And it is a certification school for learning how to do solar installations, creating housing that is inexpensive, sustainable, and earth-based. And also they just started teaching people how to teach growing healthy food as well. So it kind of hooks in, but also, for every reservation in the state, well, all the people in the state, energy, keeping warm in winter takes away a lot of money from food. So I think it's brilliant what they're doing. I would like to see a scholarship for every reservation in this state to the Red Cloud Renewables School. And, I'm considering looking at opportunities for doing a little promotion and some fundraising locally for beginning to create those scholarships. So if I can go to some of you for help, if I would like to put on a dinner at St. Paul United Methodist Church and advertise it, I might be able to find other volunteers willing to work on that.
I think too, like Fast Black Feed has their growing health program, and they're giving plant starts and so they have there's two parts of it. They do tea, so they're giving plants that are traditional tea herbs, and then they're buying those back from the community and making them into teas, and then they're also giving plant starts to folks. We help support That's Blackfeet on the, Blackfeet Reservation. They're a nonprofit. FAST is the Food Access Sustainability Team. And they're doing amazing work in that realm. And then one thing that we have worked on that I didn't touch on, we have a program called Free the Seeds, and we host a huge fair the first Saturday of March every year in Kalispell at Flathead Valley Community College, and we give away seeds and we do garden education. So it's an entire day. Last year we gave 15,000 packets of seeds out. Most of them are community grown. We collect seeds from community members. We package them because it's the easiest way to get them out, because we have 1,500 people that come to the event. It's crazy and awesome. And there's 27 classes from soil health to seed starts to, you know, growing your own garden, backyard chickens, you know, beekeeping, you know, all sorts of skills, and it's totally free to the community. So I think, and then Mitzi's doing great stuff with seeds. I don't, do you know?
Montana Indigenous Food Sovereignty Initiative.
Thank you. And they're giving away traditional seeds, you know, so there's some cool things that are happening in Montana. But not, you know, I think in addition to what you're talking about.
Are you here in Helena?
I am, there's so many different groups, I just get kind of overwhelmed, I just get like confused by, there's so many different.
If you want a food related group here in Helena, we have the Kids Nutrition Coalition. It's been together since 2013. You can reach, I'll find you after and give us our contact information, and we help with an event like that because it seems to be aligned with our purpose.
The other cool thing about Red Cloud is that, you know, through all the teaching and learning and everything they're doing, all that food is going into their school cafeteria. A lot of it. So that's super cool.
Great, more questions?
Yes, just curious, what opportunities are you guys seeing, like, meeting your own organizations or more, like, upstream on some of these issues that are maybe not able to come into your family or like not be able to access?
I'll give you guys a minute. I'll start from a statewide perspective. Is one thing we've started doing over this last year is narrative change work. Stigma is a true barrier for people accessing and participating in public food assistance programs. It's just, it's so challenging when, yeah, I think when they're young, it's easy, but you go into rural areas and you have last name stigma. Everyone knows everyone. And I was in Conrad and they were talking about people that use the food bank in Conrad actually go to Great Falls. So nobody knows that they're actually using those services. So it's just really trying to think about how we approach hunger and how we talk about hunger and have the same frame in mind, and take away the stigma. I like how Kara introduced it earlier, that it's really, it's community taking care of community, and it's not a handout. And so we just have to get past the way we talk about things and that address that there is hunger in Montana, because we hear that a lot too, that what, like not here, that doesn't make sense. So I feel like we have to start thinking about nutrition security. That's why we've kind of changed the way we frame our work at Mount Peck, because everyone needs good nutrition, and we are in a food and a health crisis together. So it's trying to find that common ground about language.
I think advocacy is the biggest thing that we work on. So we partner with Grow Montana, who is a food policy coalition. So I think that's a really great way for us to be thinking about how we can address these issues at a statewide level. In the last legislative session, we did food to farm bank, or no, farm to food bank bill, appropriations bill that we worked on with a big coalition of folks. That was really exciting. It did not pass, but that's okay, because we did get double SNAP dollars passed the session before, and it took us 2 sessions. So we're going to keep going. But I think advocacy is our biggest way. And what Lisa talked about is like making sure we're elevating people with lived experience so that they're sharing their stories in a way that helps us understand that it could be our brother or sister that's having the same issue. I mean, it's really, you know, many of us are a paycheck away from needing to go to the food bank. It's not that far away from probably most people even in this room, so.
So I'm not sure if I understand your question, but kind of something that came to mind, and I don't know if this is good. So we have, politics play like a huge role in our communities, in our reservation communities. And so, of course, when you have that turnover, the consistency is super crazy. Like you start something really good, and then you get a new term, and so everything seems to revolve around that. You know, we're a nonprofit, so thankfully we're able to carry a lot of things forward. But I think in the food sovereignty component, even if they're in the school systems locally, it's really hard to carry things forward and keep them going and keep people motivated. So to really stay focused. So I think that that's a huge barrier for us, because there's nothing, we don't even have a food pantry right now. Like our food pantry is out of a local community hall, I believe, and there's like freezers that are plugged in, you know, 4 or 5 freezers that are plugged in that. So it's very inconsistent. And so it would be cool to have like a nonprofit food, I don't even know what to call it, but something, like I said, I do so many different things, but I'm just sitting here listening and I'm like, gosh, we need like so many different food options to bring everybody together and have like a hub for all of this to go to. So that's our challenge.
I think we certainly know that hunger is a symptom of a larger problem. And there's barriers to healthcare, there's barriers to education, and there's certainly barriers to housing in Helena. You guys have probably all heard this number. It's been floating around for a couple of years now since the pandemic, but Lewis and Clark County was 5th in the nation for growing rents in the entire country, which is just totally shocking. And you know that your rent bill is a hard, you can't not pay it. You will literally get evicted, but you can play with your food budget a little bit more. And you can rely on a food bank, and that is a little bit more flexible thing. And so I think where we come in, I think hopefully maybe this will answer that question, is that we really see ourselves as probably the organization that most people in Helena go to. We see just the most people. And so we really have a great ability to distribute resources from other places. We get to sit down with people, every single one of our customers once a year, and really just have a pretty short but really valuable conversation with each person, just talking about what brought them to Helena Food Share, and figure out if there's like one other place even that we can send someone to that might use the burden or like fill another gap, or hopefully like eliminate the need to ever come back to Food Share. So certainly always thinking about places that we can refer people to. We're not case managers, but you know, we do our best to try to provide as holistic of an experience as we can. And then kind of looking to the future, we're applying for an AmeriCorps Vista project again that will be housed in our new space. And it's going to be a resource navigation position that will really just hone in on all of the resources that someone could possibly access, and figure out kind of like a service menu that could be uniquely created and given to each person. That's something that they want.
Build on that, because I think, Kara, you said it in your original presentation too, is that fundamentally, I think Taylor's question is about the inequality in our society, the growing inequality. And, you know, we should have a society that doesn't have to have all the great things that you guys are doing. I mean, thank God you're doing it. God bless you. totally appreciate this, and so this is not to take away from them at all, but, you know, we really, if we want to solve hunger, we need to push for a livable wage. And, you know, especially as cost of living goes up and up here. So I just want to kind of toss that out into the mix as a strategy. Go to.
Yeah, if I can piggyback on that too, I think, you know, something else that we talk about a lot, and I teach at UT, and so we talk about it a lot of my classes, is there's a misconception that people who are using food pantries, food banks, who are on SNAP or WIC are not employed. And they're just suckling through federal teeth, and I think all of us know that that's not true. We're working with ALICE population, right? Our asset limited, income constrained, employed population. And so I like what you said about people are one paycheck away, right? One car breakdown, one medical illness, one missed rent opportunity, right? Away from being reliant on it. So I think looking up, really think about poverty alleviation, housing access, then that's the upstream part that we need to think about. And I think we're all kind of working on the symptoms, which is awesome, but it is a bigger policy and income issue that we, you know, have to work on at that big level.
Yeah, I agree. I mean, we looked at our strategic plan. We said, like, what's our ultimate plan that were unnecessary? Like, that would be the greatest thing ever, that we do such a good job of alleviating hunger that we don't exist anymore. But right now, you're right. We're doing we're in our niche, and we're filling gaps, and we're doing our best to make sure that people feel respected, and valued, so that we maybe can have a healthier community. So I think, like, that's a piece of what we do to address that, because that's important. But the other piece of a livable wage, you know, it's a hard one for us to, you know, if we feel like if we can alleviate that need where the car payment, they can maybe make the car payment and not worry about the food so that they can get to their job. That's kind of our niche in a sense. And it sounds weird to say that, but I think that's kind of where we are. But, you know, when we think about food prescription, one of the things that I really want to happen is for Medicaid to pay for food, because the food is the most expensive part, and we raise a lot of money to pay for that food. And if we could get Medicaid to do that, then people would be in such a different position. We could address other issues. But wonderful point. I don't know if anything to say about that.
And just remember, I think when we talk about policy, it feels out of reach for the average person, but each one of you should be advocating at a local level, state level, federal level. The farm bill's right now in talks at the federal level. Feel even for state policy, if you believe in something, pick up the phone and call your local legislator. We had an event a few years ago and asked legislators in the room, like, when do you know that something's really important to your community? They're like, when we get maybe like 5 or 6 calls. Like, it doesn't take much. So please, you know that you have a voice too, and you can advocate to help all policy on this front, because it's extensive. And we can keep talking about policy, but we need something to start changing. And food bills are difficult, so please plug into Grow Montana's policy platform. You're doing such a good job with Grow Montana. I'm looking at Mara because she's here in the room. She's leading. Yeah. But know that there's a lot of food bills out there, and we need to collaborate on that too, because more than one food bill is then competing against each other. So the more we can prioritize policy, the better we'll all do.
With the trepidation of adding another thing to your plate, because you obviously have so much going on, I'm interested in whether there is initiatives for you guys or anything you know of that is addressing college student food security, and what that looks like. And in that space, and that demographic, definitely be interested in understanding how you guys address attachment or self-identification of food security, and what that looks like for you guys to have those conversations.
You know, I think in Platte Valley Community College has a food pantry. we give them coupons to come to, the Kalispell Farmers Market, through our booth, where we do our food access program. But that's really our only touchstone with college students. Here probably has much more touchstone, but, it's probably something we need to spend more time on.
We actually have a pantry right here at Carroll College. And I think it just moved. It used to be, in the, kind of the basement of the stadium area. But certainly, something we've talked about a lot is that, here in the midst of plenty, there's a lot of, people who are just scraping by. And, it's even harder. I know when I was in college, I didn't know anything. I didn't know where to go. I didn't know, you do feel very alone, and it's hard to voice that. And so we do try to put a lot of signage out. There's a class that does a lot of nutrition education, and hopefully we try to be visible as much as we can, and accessible as much as we can. But certainly an issue and something Carroll College really kind of administers and controls their own pantry. We have very little to do with it. So in our own pantry, we would collect information and collect names and do a lot of outreach. It is a little bit different. We don't know who's accessing the Carroll College pantry. We have some numbers, but we don't know what that demographic necessarily looks like.
We haven't gone much into that space. We have given small mini grants, especially to MSU. There was one of our food advisory board lived experts that was a student at MSU, and she saw kind of a path forward because there were a lot of different options for food, but people didn't know of them. So she tried to do a lot of work in that arena of like bringing things together, making more awareness, and having them coordinate better. But it just, in terms of our work, we've been hyper focused on schools, summer, healthcare, and indigenous food sovereignty. So it does, of course, reach that. However, we just haven't had that laser focus.
To go off that, every single on the Childhood Coalition board, did they mention the pre-K students? I know like our backpack has been treated like elementary school and high school. I feel like there is a gap for like daycare and things like that where we don't provide little bags like bags, and I think that's the same thing with these demographics that are really tapped into. So it's really a question about.
I think a priority is to make SNAP more accessible for college students. And I know there's some good work happening with that. But yeah, that's definitely a priority and an opportunity, I think, for any college student to get engaged while we work on these new SNAP policies and making it more accessible. I think we have time for one more question. Great. Otherwise, I'll ask all of you for some final remarks on who do you think is missing at the table? Who do we need to bring in? I think we finally have the healthcare system stepping up and supporting the food system. Who else do you see missing?
For us, I think, in the Flathead Valley, we worked with No Kid Hungry, when Lisa was there, on the Amplify Montana program, where we brought in folks with lived experience. And so now I'm working with Northside Food Bank, which is Sophie, and Flathead Food Bank, which has a new director named Chris. And the three of us are working together because we would like to create an advisory board of folks with lived experience that can advise and help us in what we do. And so we're working together to try and think about the best way to do that, which will be exciting. So, and I guess in closing, just appreciate being here and having your thoughts on the work that we're doing. And, I think from our organization, we're kind of in the storming phase. We really have grown. 7 years ago, our budget was $35,000. And my new budget is proposed $800,000. So, I know, isn't it exciting? So we've been really just filling gaps and creating opportunities that we're really excited about. So, love the opportunity to share that with you guys.
So I think a funders panel, or somebody, food is expensive. Like this whole concept is just we can't do it alone. And, you know, even just to get up off the ground would be cool, like to get a little assistance to become self-sufficient. To get that boost would be awesome. So I think having those key people would be cool to have, you know, a group of them.
This come up, I think, from every single person, but just the people that are using the service, the people with the lived experience. I feel like I'm a new person at like this event, and it's so cool to be at this kind of conference. I don't think we were ready to be here 10 years ago, and I think we were maybe scared to be here a little bit. And I think we certainly deserve to be here, and our customers deserve to be here. And every single person is a part of the food system because every single person eats. And I mean, we talk about food all day at Helena Food Share. We have gardeners that come in and use our services, and farmers, and people that their whole lives have worked on ranches or farms and are now on a fixed income and literally can't afford the food that they produced their whole life. And I hope they're all in this room someday. And so certainly lived experience. I think we all probably do our best to include that and look for feedback and have those conversations, but we can always certainly be better.
That's a really good point, and it just made me think of like how we have so many resources, our water and our land, and how we continue to grow the same thing over and over and over. So to bring like that, once again, that education component of like what you can do new for each of these, you know, farmers, ranchers, gardeners, and I know it's, like I said, generational, but we just don't know how to implement that. So.
Of course, oh, there we go. Of course, I echo the lived experience people, but I just want to say, because I missed that in my talk, that we fairly compensate the lived experts that participate and engage in our work. So by the hour, and we track that monthly, and we send them checks monthly. So I just wanted to make sure that be mindful of that, because they are stretched. So asking more of them requires sometimes fairly fair compensation. I would also go back to, you know, every player in the food system needs to be at the table. And I think that's why we focus so much on schools, because they have so much reach through all these youth that are in their presence. But many food service directors don't even realize it. It's just like, I'm just trying to get through the day, you know? And I think once they get a few years under their belt, they're like, oh, you know, this feels good. And I was passionate, and now I'm feeling that again. But all the way up to school administrators, principals, superintendents, they make choices for the entire school and school district. So involving them means a lot. We contract with Craig Crawford, who now is the principal at Stanford School District, and he's been the president of the Principals Association, and now is the president of the Central Superintendent Association. It's like the more you can engage them and they realize their part in this system, even though if food doesn't necessarily directly relate to their everyday work, they need to know that they can do more and make decisions that will affect their entire community. So think about who those key influencers are in your community, and they should all be at that table. So I'll end on that.
Thank you all, and thank you for the great conversations and questions. Bring those thoughts to our session this afternoon. And if you have a minute before you leave this room,